Good evening. Welcome to our month-long e-campaign on breast cancer awareness brought to you by IHW Council and Novartis India. This is the second edition of the Breast Cancer Action Month, where we will bring together all stakeholders, be it policymakers, experts, oncologists, social workers, influencers, and cancer warriors who have successfully overcome breast cancer on this platform to create awareness about the disease and motivate everyone to take proactive action to reduce its risk. We believe that even if one life is saved because people are talking about breast cancer, the Breast Cancer Action Month will be a success because this killer has been devastating families, wrecking dreams, and causing immense strain on a healthcare system at a time when we are already battling a pandemic. October is observed world over as Breast Cancer Awareness Month, and we dedicate our efforts to the brave ladies and men who are fighting this disease. I'm your host. My name is Anisha Nair Thaban. Let's do a quick recap of all the ground that we covered in our campaign last year.
Breast cancer is the number one type of cancer in women today.
मुझे आज ब्रेस्ट कैंसर एक्शन डे से उम्मीद है कि जागरूकता और उपायों के बारे में लोगों को बताकर हम देश में ज्यादा लोगों के बीच कैंसर होने से रोक सकते हैं.
I'm confident that the contribution of the Integrated Health and Wellbeing Council will certainly help in checking and treating cancer.
That this is preventable, provided we feel ourselves on a daily basis. We love our bodies, we value them and take care of them.
Awareness around cancer, awareness around women health, awareness about around all the artificial things that we engage in, and vanity has its own impact on our health, and I think it's time to turn the tables on the other side.
In order to defeat breast cancer, it really takes a village. In other words, it's take a holistic approach, not a silo approach.
The problem is really at two levels. One is, like I said, with the media centering a lot of communication around what is significant in that month. And the second is, as a society itself, we just don't want to mention the word breast.
We have to create a complete ecosystem which can really help early detection, early treatment, and help patients live a longer and healthier life.
Make sure that you put the patient at the absolute center of any solution that you design.
We have to educate them to do their self-examination first and to encourage the women to go for tests, which is very, very important.
I see role for each and every one to come together and, make this Indian healthcare system a very robust one.
Nothing stronger, this applies to than cancer prevention as well as early detection.
week, we have heard oncologists, social workers, influencers, cancer warriors, and experts talk about breast cancer, and nearly everybody agrees that early diagnosis is the key to fighting this killer successfully. We've also heard from cancer warriors and support groups that along with the latest medical advancements, patients need love, support, and empathy in their battle against this killer. Here are some highlights of what our experts have discussed during the shows we have had so far in October.
Welcome to the second Breast Cancer Action Month, a mega month-long movement to strengthen awareness about breast cancer and encourage action against this fast-growing public health menace.
The multiple level work is required to diagnose early so that we can cure most of the patients of the breast cancer.
The bottom line is the lady should be made breast aware.
Number one, clinical examination. Number two, an ultrasound if a lady is young lady as Neha, or a mammogram if they're above 40, and a guided core biopsy. Triple assessment, 99.5% will give two answers. It is not a cancer or it is a cancer.
We are going to get better. The diagnosis is going to be early, and hopefully patients, individuals who are unfortunate to get the cancer will be fortunate because they will get access to better and better treatments.
It is the fear that we need to understand. What is it that the woman goes through when she is diagnosed with breast cancer?
Not for diagnosis or of cancer, but we would like the person to be familiar with a normal breast. The individual should be familiar with a normal breast.
Understanding the complexity of the disease, developing innovative therapies that changes the curve of patient survival.
It is really important for a clinician to understand the tumor makeup, to deliver, to offer the right treatment for the right patient.
The type of surgery also influences the survivorship. If patient has undergone a conservative surgery, means breast has been conserved, these patients have better life compared to the patients whom the whole breast has been removed.
About self-breast examination. There are enough studies today to show that it is the most cost-effective method of detecting breast cancer early for a country like India with low socioeconomic status, and we don't have mammograms everywhere.
When we talk about awareness, it's not only the stigma, but it's also about the fact that it's not contagious, it's not infectious, it's something that is happening within your body.
You should live each day as it comes, and then you aspire to inspire before you expire.
With or without the disease, with or without a positive or negative prognosis, visualize the future and the life you want.
Breast cancer is not just a chronic disease that many women in our country have to battle. There is hesitation to talk about it because it affects the breast, an intimate part of the body that the society is not very comfortable discussing openly. Not only is there some sort of stigma attached to breast cancer, the battle is not an easy one. Women are the pillars of their families, and when their health takes a hit, when they need care and support, normal family life could get disrupted. Because the treatment is tough and requires time to go through the entire course and follow up, workplaces also have to be supportive with leaves and empathetic environments to encourage women to fight breast cancer successfully. So how can families step up to help women fighting cancer? Can women continue to work along with their treatment if their employers are not generous with leaves? Does the financial burden of treatment also bring stress to the patients and their families, and how can this be reduced? These are some of the questions that we will be taking up in our show today. Please welcome our panelist, Srimati Harichandana Dasari. She is IAS Collector and District Magistrate of Narayanpet in Telangana. We have Dr. Lalit Mohan Sharma, Senior Consultant Hematologist and Medical Oncologist, Department of Medical Oncology, Sri Ram Cancer Center, Mahatma Gandhi Medical College and Hospital, Jaipur. We have Dr. K. Kalaichervi, Senior Consultant Medical Oncologist, Apollo Specialty Hospital, Chennai. We have Dr. Ekta Gupta, Scientist, E-Clinical Oncology, National Institute of Cancer Prevention and Research, we have Ms. Neeti Lekha Chhabra. She's founder and president of the NGO Yes to Life. We have Dr. Kamala Rai, Vice President, Senior Global Program Head, Global Health Development Unit, Novartis. And we have Dr. Sneha S. Puyar, Chairperson, Breast Committee of FOXI. A warm welcome to all of you for joining us on this show. And thank you so much for sparing the time. Neeti, I'd like to start with you. Is there a stigma still attached to breast cancer? Because, cancer is becoming more common these days. Nearly every family, will have some form of cancer or the other. Is there a hesitation to still talk about this and what the person goes through when taking treatment?
So yes, in India, I think cancer in itself is still considered a taboo in many parts of the country. And yes, if it is of the breast, then that's a bigger problem, because supposedly breast is just a sexual organ as we all see it. And that is why all the inhibitions around it. And it's not just the men or women or educated or non-educated people. I think that stigma or that inhibition to talk about your own body is present everywhere. And I have seen people who've not been to the doctors at the right time because they were so hesitant to even talk to their family members, that there's a change in the breast. There have been times, when people have said that we could not find a female doctor, and we weren't comfortable to go to a male doctor to show ourselves. So there is a lot of awareness, not just in terms of, like to do a self-breast exam or to do screenings on time. I think sensitizing the society to let them know that it is just a normal body part, before anything else. That is a very, very important part here. And it is so much that I remember I had a breast cancer awareness talk once in a factory. And since I was about to teach them how to do a self-breast exam, I just generally asked the ladies, that all of you must have touched your breasts. And they literally started looking at each other, giggling, and there were a lot of kicking sounds and everything. And most of them said no. And I was pretty surprised, and they were mostly married women. I asked them, how do you take bath? One of them actually stood up to show me. She said that I apply soap till here and then soap from here to, towards my head. So they were so embarrassed of their own bodies that, they would not apply soap on their body, on their breasts. And I literally had to shake them by telling them, that you have a physical relationship with your husband. You're all married women. What are you so shy of your own body that you can't even apply soap? But that is how it is. And it is not just there. I mean, there are different kinds of problems when we talk about educated workforce, like educated households. Just to give you an example, when we have to dry our clothes after washing, women's laundry is usually dried at a back rope, where nobody can see, right? But you don't have that kind of thought process when you're drying other people's clothes. So it is just to say that we have to do away with this thought process, that if it's about our body parts or if it's about our clothes, everything has to be under wraps so nobody can know, talk about it, see it. So I think we require as a society to make this change in our thought process.
Right. Dr. Puyar, have you seen this, what Neeti is talking about? I would think that now, we're moving with the times and, people should be more open to talk about breast cancer without feeling, a stigma or hesitation that this is a very personal part of my body. What have you seen in your practice, in your experience?
Yes, definitely. I share the same experience, I would say, rather. As a breast committee chairperson, I'm doing this work since last 3 years across India. But as a gynecologist, I'm working into this field since last 30 years. And even today, examination of the breast is, equally, it's like they find it so obscure and so different, shameful, as if examining the internal, the genital examination you're doing. So that, they're very, very awkward for this examination. They're very awkward as far as sharing even the difference in the shape and size and whatever problems they have. Same thing as Dr. Neeti has already shared with you, that the clothing also how they dry in the closer areas, and that's the very reason, just to utilize this opportunity, that's the very reason we are not advising the women to use the cloth napkin. They dry it at such a place that that becomes infected and difficult to use. Nowadays that concept again for the menstrual hygiene has come, that they should use the cloth napkin, but yes, fully sanitized or fully dried in open sun. That's how. So coming to the breast cancer per se, once again, it's all about body shaming. Women are not comfortable even talking about their breasts. Forget about examination. So even as a routine gynecologist, when we ask them that, every woman, we say, even so you're 40 plus now, I think you should better, now that you have come to us, might as well get examine your breast. They'll say, no, why? I don't have any problem. So they're not comfortable. And if at all we tell them that, okay, it's okay, if you don't have, I will just examine, because your examination and my examination is little different. And if at all you don't find any abnormality, we will teach you how to examine properly. That, self-breast examination, if you don't have the knowledge of the science, you may not be able to detect what abnormality you have. But if I teach you and I do the clinical examination, maybe the chance of detecting abnormality is higher. And that is what the evidence also says. So they are not comfortable. They're not open about their breast. And of course, they are not at all aware of the breast cancer. And they are, they are taking it as a stigma even today. That no, breast cancer, no, not me. I will not have it.
Dr. Ekta, is there a difference in the perception of breast cancer in urban versus rural areas? And if women don't want to be examined by a trained professional, a trained medical professional, then how are we going to catch breast cancer early? Because in our country, CBE is being considered the way forward. To involve as many women to come in for a CBE as a screener. We can't have more mammograms in our country. We have a young population where the breasts are dense, and we don't have the infrastructure and the manpower to do mammograms in every corner of our country. But if women are going to feel, I can't have somebody fill me up, then how are we going to catch this early? And is there a difference in perception about breast cancer in urban areas versus rural areas?
So, Anisha, when we're talking about stigma, you see, one important point which is related to this is there is this fear of getting diagnosed. Okay, so it's like if we get examined, what if we have something, or if we are coming out to be positive, then what about the future? So there is that inherent fear, stigma. Also, there is this one portion which is, yes, of course, there is shyness, there is considering breast as a sexual organ. But another important reason for stigma is also related to what is the future. So what will happen to my family? What will happen to if someone is as young as say 20s? So what will happen to my married life or whatever? So we have to understand that answering or eradicating that stigma, it has to work at different levels. So when we have to understand the social construct, see, we are living in a society where of course women are still not at the forefront. So women's health, women's issues, they are always at the back. Of course, times are changing, people are coming about talking about the things, and we are getting more vocal. But still, there is a long way to go regarding urban and rural areas. See, of course, in the urban areas, there is more exposure to, IT, communication, social media and all. So, of course, awareness-wise, if we talk about awareness is more in the urban women. They are more forthcoming when it comes to, getting access to health services. So, of course, all these factors are there better in urban areas as compared to the rural areas. Rural areas, we are still, we have the archaic society where, of course, women's issues are always at the, back front. And women, they are not very forthcoming. So if there is any issue, and one more important point I would like to raise here is because breast cancer does not have symptoms, there is no pain, there is no, very visible symptom. So usually women, they tend to ignore it, and usually they tend to hide it. till the time it has grown to the stage 2B, stage 3, it has infiltrated the local breast and all, and it has moved. And when it has moved to stage 3 and 4, then of course the survival and the mortality rates are obviously very poor. So urban and rural areas, the main differences and the main perceptions which we are talking about is the awareness and healthcare system, of course, is better in urban areas. So women are still better up. So if we talk about Delhi NCR region, which we are catering to, we get women who are ready to undergo breast examination. So for example, at our institute, we are running a screening clinic where we are doing the opportunistic screening. So any women who's coming for any cervical cancer or any, so we are screening women above the age of 30 years. We are teaching them self-breast examination. We are doing the clinical breast examination there, and we are teaching them how to go about it. So we need to inculcate that culture. We need to, awareness has to be more. And for this, what strategy which I think works wonders and which we have personally seen is working is when we are targeting the adolescent and college going girls. See, this practice has to be inculcated right from that stage, that yes, you have to consider it as to be a normal. It is very normal. We cannot teach it to say 40 years, 50. Of course we can do it, but the benefit of teaching the health education and all, it is more when we're targeting the younger generation, because they are aware, they are more aware, they can understand. So like last week only, I had a health education program in a school, in a Gurukul. And of course, there is this hesitation, which, Neeti was talking about, that when women are giggling and all, that was also there. But after a point, we found that all the girls, they were very forthcoming. They had their own questions in mind, and, they were coming up, so they are like, we'll tell it to our mothers, we'll tell it to our, relatives. So I think targeting that age group is a good strategy, which is work we are targeting. So we are doing that on a regular basis. So we are conducting awareness programs in colleges. We are doing awareness programs in the schools, so that culture is inculcated, so that breast is not considered as, some intimate part, or it's something different, and we need to examine it. So I think that goes a long way. Yeah.
Okay. Dr. Kannan, in your experience, in your practice, what have you seen of the family members? Are they supportive of the woman undergoing treatment? Because, first of all, women put their health last. Then the family has to support them financially as well as physically and emotionally, because there may be days where they'll be out of action and somebody will have to do the work that the lady of the house does. So how supportive are families for women undergoing treatment? And how do you as doctors counsel the family? Because that's also important. The caregiver, they have to be briefed about the treatment, about what lies ahead, how to take care of the patient, because the patient may have side effects. So how do you counsel families?
Yeah, mostly educated ones are able to understand. The family is very supportive. The middle class and the upper middle class group they are definitely able to support everybody. And the family, whole of the family itself, they come together and do everything for the patient and make sure that they come out of it very nicely. When it comes to the rural areas, you find there are many who are not very supportive, and they have to have their daily wages to come to the hospital itself, sometimes to the city to have a chemotherapy. And these people, they find it difficult, even though we give a railway concession form and also bus concession form. And now the National the Health Mission has made NCD clinics run a peripheral chemotherapy centers, which is going on for the last 3-4 years very successfully, where we give chemotherapy prescriptions from the tertiary hospitals, where they have chemotherapy at the periphery or the taluk headquarters and primary health centers, which is going on very nicely. I think with all this, they will be able to manage. But when, on the surface, when you see the middle class and the upper middle class are able to support their family 100%, whatever it may. Like they get treatment even in private hospitals, they are able to manage. Whereas in the rural setup, I think it's 25% who are able to afford to have a private separate treatment in a private hospital, whereas most of them go to the government centers and get the treatment. And when we counsel the family, we tell them, if you have a proper treatment, she can be as normal as possible and she can go back to her routine life. So that's one thing. Second, we tell them that this is not a contagious disease. You should not separate them from the family. And so you keep them along with you and show your love and affection throughout the treatment. And during the post-chemotherapy period, they need to give the support in the form of the suitable diet, more liquids, and the tablets to come out of the side effects for the first 1 week. Whereas the next, second, and third week, they become better. So we tell them to complete the treatment as a whole. Like after 3 cycles, they will say, no, I don't want to go through because it's difficult and other things. And so we tell them that you have to complete the whole lot of treatment. And also for alopecia, we tell them, see, the alopecia is not a big issue. See, right from the first consultation itself, we tell them that you can get a wig made, ordered. So you can have a normal appearance as before. And also after surgery, we tell them that they can have a breast prosthesis so that when they go out for work or when they go out for functions, they can look as normal as possible. And we also counsel regarding the cost of the whole lot of treatment, even with the private hospital. So the whole lot of, if you tell them beforehand, they'll be prepared to go through the whole treatment and they are ready to take up. So most of the middle class and the upper middle class are 100%, they support their family, whereas the rural, because of the, all these financial issues and sometimes ignorance, they think it will not become all right. But the women are positive. They are willing to come. We have lots of women from the rural areas who come all alone, at least 400 to 500 kilometers away by train, come get treatment and go back at the same night in the government general hospital. So we have such kind of positive women. So they need counseling and a positive approach to the whole lot of treatment, that it is possible to cure breast cancer and they can be as normal as possible in their life and lead a normal life also.
Right. Dr. Sharma, you wanted to come in on this?
In fact, I think most of the things have been covered by Dr. Kannan, which I wanted to convey. And we also have the same experience that family is supportive. What matters is the initial counseling after diagnosis of cancer. So as doctors, we usually spend more time in talking to the patient herself. And we usually talk along with the in-laws also, like we talk to the brother, sister of the family and the in-laws of that lady also. So we counsel in a group session and usually we present them in a very positive way. In my state, Rajasthan, the government has good schemes where we can offer them almost free treatment. So that includes surgery, radiotherapy, chemotherapy. So that all is covered under some Chiranjeevi Swasthya Yojana by the government.
Okay. I want to check if Ms. Dasari is here with us. Ma'am, we wanted to find out about the schemes that you have in your district. And, like Dr. Kannan has mentioned, like Dr. Sharma has told us about the experience in their states. I understand that some of the South Indian states have a very good system in place. And some of the, treatments, even the screening is very affordable in places like Tamil Nadu, even in Andhra Pradesh. So I just wanted to check with you, ma'am, what is the situation like in your district? And what are the facilities that you provide to women for cancer care and diagnosis?
Am I audible?
Yes, please go ahead.
Good evening to all the co-panelists and the team here. Basically, I was just following the conversation which was going on much ahead of this. And I just wanted to add to what Dr. Kannan and Dr. Lalit Mohan and others have shared before. It is, I've been noticing, I've also been actively a part of trying to curtail breast cancer, and I've worked with a lot of CSR companies also who are trying to help us out, and also in the rural areas, because I'm working in the rural areas. So just to add a few points to that, one thing I would say is most of the rural women are very scared of a mammogram. So, though the treatment is very affordable, like you said, and the government is also very, very proactive in terms of we have weekly cancer checkups, both breast cancer and cervical cancer. And we also have a very active palliative program which goes on in our state. So apart from this, we do try to reach out to the rural areas in terms of sending the cancer checking devices on vehicles. We even do mobile checking.
Screenings.
Yeah, screening. But then once we do this, we realize a lot of rural women are reluctant to have a mammogram or have an examination itself.
Why? So, is it because of the fear of the procedure, the discomfort they'll go through, or are they scared of being diagnosed positive? Why are they fearful?
It's more of the discomfort in terms of the checkup itself, that the screening itself, the process itself, which is quite alien to most of them. So they will say, I don't want somebody to touch me. I don't want somebody to examine me. So these are the issues which we face most often. It's not that they don't have the reach or the screening is not available to them. It is available, but there are both. There are also people who say, okay, I don't want to be diagnosed. I don't want to have a health issue on my hands. But that I find is a minority. The majority of them would not think, okay, I'm all right. I don't show any symptoms. So why should I go for an invasive screening process? So these are the things that we face. And in fact, I would like to share an interesting thought with all the doctors and the panelists here also. We've tried a no-touch screening process, which is more or less like your radio frequency one, which you have at the airport. So we just ask these women to sit a little far, and they don't have to disrobe, or they even don't have to ask somebody to touch them, but just have a no-touch screening process. And I've seen great results, especially in the rural areas when we do that. More and more women come forward because they would prefer not to have any pain even during the examination. So that is one thing, if we take it out, because we are a society which has a lot of hesitancy, and we also do not, as a family also in rural areas, there's no encouragement to go for an invasive checkup process. So that if we tackle that, I think the reach will be much higher for this screening process.
Early diagnosis.
Also, yes, the early diagnosis would be very efficient. I am no expert in telling you whether that's an efficient system or not. The expert panelists here would be able to tell you that. Right. But I think that's a thought we need to explore on a larger scale across the country.
Right. I think Dr. Buyard wants to come in, but Dr. Buyard, I just want to, like we were discussing diagnosis just in our previous show.
No, before diagnosis, I think some social aspect I just wanted to speak as a committee chairperson. Across India, we have so many gynecologists actually participating in the awareness and the screening programs. So basically what everybody is discussing, that we do not have the organized screening patterns here. We do not have organized screening strategies, but we have to go for opportunistic screening. But then the women of rural area, they're very, very, they are having lots of social and cultural taboos, as madam has just said it. But then we have to, make them aware of what difference it makes when you diagnose the breast cancer early, and what is the difference as far as the clinical outcome and prognosis is concerned. Secondly, they are all the time, feared. Everybody's talking about this. So they're having the fear that if diagnosed of breast cancer, what next? Whether they have the easy accessibility of the treatment, whether they have the effective referral system where they can reach, and whether they have the affordability. So all these things definitely matter as far as the screening programs are concerned. So that's what I think I have to share from my side. Thank you.
All right. Maybe I want to ask you, when you were diagnosed with cancer, initially I'm sure it's a shock, and you have to tie a lot of loose ends, treatment, who to go to, where to start the treatment, what treatment to start. It's a lot of information, a lot of things that you have to handle. But what about your work? did you work during your treatment? Because for the financial strain is something that also takes a toll. So women don't want to give up on their jobs because it's very expensive, the treatment. So they need to have that income coming in as well. But they need the treatment. They need to take time off. So what did you do? Did you continue to work? And is this also a major issue for women with breast cancer?
So my diagnosis happened when I was 31 years old. This was back in 2012. It's been a lot of years. I was actually working as a professor at that time. I was teaching with the B school as a full-time faculty. And when the diagnosis happened, one, of course, since we're talking about not being aware, I was actually one of those people, just to put it in perspective here. Like when I felt a lump on my breast, I actually did not know what kind of a doctor to go to also, I actually Googled who to go to if you have a breast lump. So that was the level of me being unaware of, what if something like this happens, or what if you find a change in your body. But coming to your question, for me, when my diagnosis had happened, I resigned at that time only because I just wanted to focus on being well. Thankfully, there's no family history, so I really did not know what to envisage, or, how much time does it take to recuperate from the treatment, or how difficult or easy is the treatment. So for me, I just wanted to get well, just focus on,
your health,
back to my normal life. And then I had thought, that I'll get back to my job after that. But I know of a lot of women who have continued work, even while the treatment was on. And what most of these women have done is that they kind of plan their chemotherapy in a way that they have a sitting on Friday, So Friday they took, they take a leave, and then Saturday, Sunday is mostly off. So by the time Monday comes, they have gathered the energy again to go back to work for those next 4 to 5 days. So I have seen a lot of women continue to work while they were on with their treatment in this way. I have also seen a lot of companies being very supportive, so they would allow some of them to work from home if they have, if they were not feeling fine. The co-workers also to be very supportive. But again, I've seen a mix in this also, because I've also seen a lot of people, telling me that, that I want to give a job interview, or, the people in my company would get to know that I have cancer, since my hair are falling. I don't want people to know about it, because then there are too many gossips going around. There are times when people are not that supportive. There are times, when people come and probe about, did you have to lose a breast to it? So not everybody is as open to discuss it, while they are undergoing the treatment. So while there are a mix of people everywhere, but yes, it is not impossible to continue to work while one is undergoing treatment. And specifically, if it is diagnosed at, if it is diagnosed at an early stage, the treatment also goes on only for a stipulated time period, So even working with that becomes easier than as compared to when somebody is diagnosed at a later stage.
So, I have an incident to share. There was a senior colleague of mine in my previous workplace, and we didn't even know that she had cancer. She was gone. We thought she was taking a vacation, and, she was back like her normal self, only with a haircut. So, it depends. Some employees are very, very supportive. She was given enough leave, and nobody came to know until she decided to speak about it, etc. She was back to normal, the way she was at her workplace before she took her leave and underwent the treatment. So it depends a lot on employers as well. But I want to ask you, Dr. Kamala Rai, workplaces, in any case, many women feel discriminated for a number of reasons, despite many of our leading companies having a range of diversity and inclusion programs, especially now. Do you think that breast cancer adds on to that? And what are the ways in which this can be addressed? Do HR departments need to talk about this proactively so that the inherent bias and discrimination doesn't happen? And, your co-workers are more supportive to pick up on the work that you cannot complete, give you the time to be able to do things perhaps a little slowly than what you would do earlier. So our HR department is talking about this.
Yeah. Thanks, Anisha. Absolutely. I mean, before we go into the breast cancer specifics, I was just reading a report. I don't know if any of you chanced upon it, on the global gender gap index that was released in March of this year. And the discrimination and the opportunities, be it in education or political empowerment or economic opportunities, as well as health and survival. I noticed that India's rating has in fact gone lower, and now we stand at 140 out of 156 countries. And that's not a pretty picture. And obviously, if that is the state of global gender gap, there would be a spillover. Even breast cancer survivors then, would be impacted by this topic. Having said that, I'm very pleased to hear Neeti's story as well as other stories on, how there is a learning agility within the breast cancer survivors. And more importantly, also, if you look at data from the West, breast cancer survivors, the US breast cancer survivors report to work almost in 90% of the cases within 1 year. And I didn't find study from India on how soon do breast cancer survivors return to work in India. However, in Europe, there's this extensive study, and they noted that Netherlands, 43% of breast cancer survivors report almost, I think, within 1 year. However, US stands tall. Australia and US, they don't have that kind of mortality. The 5-year mortality is less compared to India. So I think in India, as the experts have also pointed out, the diagnosis is done at a later stage. Therefore, the mortality is higher. And therefore, if the diagnosis is done later, the kind of complications that a breast cancer survivor would report back to work, for example, if there's mastectomy, we know that there are the other complications, lymphedema, or, the range of movements is affected, and a host of other complications. And also, if you look at stories from global stories, one story, it's actually called STORY, acronym for STORY, which is Sisters Tell Others and Revive Yourself. What I found that in that interesting story episode was that when it comes to family and healthcare professionals, there's phenomenal support. So the support also is divided into positive support and negative support. But when it comes to everybody else, it sometimes tends to get annoying. And the reason for that is a lack of sensitization to the problems that breast cancer survivors have. The rehabilitation. Now, thankfully, the emerging discipline of psycho-oncology or oncophysiotherapists and occupational physicians also, they're sensitizing workplace to make sure that the rehabilitation is smoother. And end of the day, what do breast cancer survivors want? At the core of it, what do they want? They want to be treated as normal as anybody else. Not organization, but not extra, being left alone. I think it's a little fine balance. And I think this holds true for any survivor, but particularly I think for breast cancer, it gets a little complicated because there are other psychosocial issues. More importantly, depends on the type of workplace, the restrictive cultures, if at all. India, and I think the previous speaker mentioned about that, the cultural setup. The Chinese ethnicities has been reported to report back to work immediately, and acceptance is easier in ethnicity. So I think it's a lot of socio-demographic aspects, psychological aspects, and particularly to your question, Anisha, I think workplaces now are getting sensitized. There's zero tolerance for, at least in good institutions. I'm glad Neeti mentioned there was, easy acceptance at workplace. However, it may not be universally the case.
True.
However, now there is zero acceptance of,
discrimination because of health. That's obviously to an extent because of COVID, with so many people affected in your own offices. Then, of course, people have had to, step in and work in their place, be supportive. So let's hope that this translates into other, chronic conditions like breast cancer as well. Dr. Sharma, is there any flexibility on when you can get your chemo done? In our country, work-life balance is something which is utopian. The employer feels that आपको तो काम करना ही पड़ेगा, deadline से पहले submit करना ही पड़ेगा, project complete होना ही पड़ेगा. और everybody works 9 to 5. Even, doctors also have a work life. They're not there all the time. The flexibility in our country is not there. So is there any flexibility in the medical system for treatment to be flexible, chemotherapy to happen in the evening? Any of that, is that possible?
I think that is very, very relevant question. And from the doctors, and we are very flexible with the patient. We try to fit into the patient's convenience. Of course, we try to maintain the intensity of the treatment. So usually we try that you can come on the weekend, like Saturday or on Friday, late afternoon Friday. Many times we ask them that you go on Friday morning, put your attendance, talk to your boss, and come back in the Friday afternoon. So after 1 o'clock, the lady comes, she get most of the chemotherapy treatment on daycare basis, goes back in the evening home. So most treatment is daycare based. There is no intensive admission. Other thing about the flexibility part from our side, we are 24/7 available to our patients. So we give our cell phone numbers and we try that we link them to their local doctors and as and when if they are not able to come to our center. So that also becomes one flexibility that anytime they can message and they can talk to us. So that remains a good, we most commonly put them on a chemotherapy port and it goes very smoothly. One important comment about returning back to work. In fact, most of the rural females which I cater in Rajasthan, in Jaipur, they go back to their home and they start working. In fact, it's not an office work, it's their home work. So at their home, they take their duties of cooking food, taking care of their cows, buffaloes, their children, their in-laws. So everything they resume so fast. We are proud of those young women who are not educated, who don't go to office, but we also promote that you keep doing all the work which you were doing before getting diagnosed and treatment for the cancer. Other important, one more point, if you allow me, I can share that
yes,
most of the patients who come in touch with us for treatment, in fact, they teach us a lot of issues, lot of things. Like I remember one patient of mine, I will not name here, but she's an announcer at the state level of the government functions. In fact, the programs for 15th August and 26th Jan, she's the top announcer. And she was undergoing chemotherapy and she had severe mucositis, severe pain in the oral cavity. She was not able to speak well and she had ulcers in the mouth. And on that day of 15th August, she told us that I want to go as an announcer. I don't want to quit. I don't want to take leave. We all refused that on medical grounds, we will not allow you for the same. But she went there, she took 2-3 painkillers, 1 injection, and she did all the comparing and announcement on the 15th August parade. And that was probably the best announcement she had ever done. So these women, these patients, they give us a lot of power, energy, and they teach us all these lessons. So we give examples, we connect many patients to these patients who are bold and brave. So that all gives energy, in fact, both of us.
Right. Dr. Ekta, you spoke about how nowadays there is better counseling. There is better counseling because, oncology teams discuss everything in a transparent fashion with the patient. They explain what is happening. They bring into confidence the family members as well. So when it comes to the medical aspect of the treatment, most of the bases are covered. When it comes to the emotional aspect, that, women sometimes feel emotionally drained. There are issues of financing the treatment and how that stresses women or being a burden on the family. I'm not sure if, the counseling teams are sufficiently equipped to address all of these issues. So what has been your experience? How do women deal with this kind of strain?
So Anisha, when we talk about the financial aspects, so very rightly pointed out that all the teams, oncology teams, of course, nowadays in big corporate hospitals and all, so they have teams which are looking after the counseling. We have separate counseling team regarding the finances, regarding the doctor medical team, which is explaining about the prognosis and all, but it is to a very limited extent. It is not yet percolated, to the ground level or to the deep levels. So, of course, the expenditures on the cancer treatment and all, they take a big toll on the patient and their families. We have schemes from the governments, which are central government as well as state governments, for the financing of cancer patients, and they have really cut the out-of-pocket expenditure, and they have really helped patients. But of course, there is still a long way to go, and hospitals need to come up with better plans and better counseling regarding the emotional aspect. See, emotional aspects also, a lot of doctors themselves, they are doing that. So a lot of doctors are taking, because they understand what it is like. I'm sure Dr. Sharma and Dr. Kannan, they all will agree with me that they take that extra effort to explain the patients. You talk to, because whenever, even in our clinic, if we are getting the screen positives, so if we they have the chances that there'll be confirmed cases. So that time also we are counseling the patients. So what if we are getting what if it is positive? So how can you manage that? We talk with the relatives, we talk with the husbands, in-laws, we tell them that please come with the family members. So we start the counseling right there. So not even before it is diagnosed per se, but even if screen positives, where there are chances that 70% it will be positive. So we need to inculcate that, and a lot of doctors are taking that initiative. I am happy to share that, but still there is definitely a long way to go, and we need to address that emotional and financial aspect, and we need to figure out how we can ease that burden, so that they can really look into the chemotherapy and medical aspects, medical treatment.
Right. Dr. Kannan, unfortunately, in our country, many women are diagnosed with breast cancer in the later stage for whatever reasons. Now, at this point of time, how do the families take it if the patient has advanced cancer? And what do you do when there is pressure from the family to prescribe pain medication or morphine for patients? Because that also, like you're seeing your family member everything in pain, and you go to the doctor and you beg, please help her. Because, at that point of time, they need that palliative care. Do you feel pressure from the family? How do you handle that?
Yeah, most of the time, in fact, when the patient has the pain, we ourselves volunteer and tell them that she needs to start on painkillers. And then sometimes you find strangely that the family members are not willing to give painkillers, thinking that it will make them get addicted to that. So they will give one tablet, they will keep all the tablets with them. They give only one tablet at a time, or only in the night, something like that. So we used to sit and talk with the family members that the quality of life during this treatment, or during the the end of care, or when there is an advanced disease, very important that you need to keep them comfortable with painkillers. We have to tell them to take this morphine patches so that they don't have to take tablets more often, and also other tablets. And we put them on to in a private hospital. We have palliative care specialists who can prescribe the whole set of painkillers, keep them comfortable. But in places where there is no palliative care, or where we do all the talking, and we have to make the patient's relatives sit and talk to them for nearly 20-30 minutes about the importance of painkillers. This has happened many times in my clinic, where the relatives are not willing to give painkiller. The moment you say morphine, they are scared, that means the patient is going to die immediately. So it's not so. The quality of life can be maintained with morphine, and only say 10 to 15% come up and say, can we give morphine? Can we give more painkillers and all that? So we do counsel them, and it's very important to talk to them on 2 to 3 sessions on the importance of pain relief and other palliative measures to keep them comfortable during the treatment and after the treatment for advanced cases.
Right. Dr. Kamla Rai, usually cancer care is not covered in group insurance policies. Most medical policies also, if you buy health insurance, will not cover many types of cancers. So what could be done here? If your good companies also have, some sort of, group insurance which covers cancer, what is the option for, from the corporate sector to help in this, shoulder some of this financial cost, because it's quite significant for those undergoing treatment?
Yeah. So yeah, the short answer to that is, am I audible?
Yes, yes. Please go ahead.
Yeah. The short answer to that is yes, absolutely. I think as a responsible, the pharmaceutical company has mechanisms in place to address that that gap. I think it was Dr. Lalit Mohan who also mentioned about what the state government is doing in Rajasthan to ensure that nobody is left unattended. And I think that's the same aspiration for everybody. I think all the stakeholders. And there are patient support groups and there are mechanisms through which, and everything has to happen through the physician, right? We can't directly interact with the patient. And there are mechanisms to, fill in the gap financially to the extent that's possible. And there are frameworks within the organization. There is an ambition and that there is, so that no patient is left unattended. Absolutely.
All right. Let's hope that we'll see more companies coming up with plans to cover their employees. Given what we've seen in Corona, in the case of the COVID pandemic, a lot of companies have stepped up to help their employees, and let's hope this translates into these significant chronic diseases like cancer that many of Indians have to undergo. Ms. Dasari, I wanted to check with you if you could tell us about any financing schemes that you have for cancer treatment, because you spoke about screening programs and how you run, how you're trying to take early diagnosis to the insides of our country into the rural places. You spoke about the hesitation women have, but once diagnosed, the other thing which is stressful is, where will I find the money? Now I'm going to be a burden on my family. So what schemes do the government have to help women here? At least this should not be a reason for them to not come up and say there's something wrong with me, please check me up.
Yeah, when it comes to government, I'm sure like other, at least down south, I come from Telangana. So here we have palliative care centers. I have also mentioned that before, not just the screening centers and also the treatment centers. So all the government hospitals cover these programs, and we have dedicated cancer hospitals also, which are run by the state. So people who need care and attention can find treatment in these places. Now the Telangana government has also been very proactive in establishing palliative care centers in all the rural CHCs also. So there is a mobile palliative care center which goes to give treatment to the people who cannot travel to the hospital also. And also at all the district hospitals and the regional hospitals, we have palliative care centers in all our hospitals. So people are covered end to end once the diagnosis happens and the treatment is going on.
And ma'am, if I may ask, what is the waiting period in public hospitals in Telangana? Because like in major centers like AIIMS in Delhi, by the time your treatment starts, it's already progressed because you have to wait. So what is it like in Telangana?
Yeah, it's almost, you can just walk in. We don't have major waiting periods. And our palliative care, at least the district that I'm handling, we have about 146 patients on our palliative care system right now. So this is a very effective system. And you've also heard about this health insurance scheme, I suppose in most of the South Indian states, which we have called as Aarogyasri. It is there in Telangana and Andhra Pradesh, where even a patient can approach any private hospital, which is a part of the healthcare scheme, and they can take the desired treatment for these, and cancer is covered with that. So it covers basically the health insurance that you're talking about. Any person below poverty line can take this scheme up if they do not prefer the healthcare system which is provided by the state.
All right. Dr. Buyar, what has been your experience when it comes to the financial strain that women face when undergoing treatment? And a number of companies have support programs. A number of corporates also run schemes where they will help financially support treatment of some people who really could not afford it at all. So, how do the patients come to know about this? They're already not aware of, what the disease is or how will it affect them. Where will they find the money? They don't even know that, there are support schemes. So who will tell them? And, are there support groups to give them the information?
I think we have the social workers across the hospitals and majority of the institutions who are, when we are counseling them as far as the treatment part, especially right from surgery, chemotherapy, radiotherapy, and even the long-term treatment. So if at all the woman herself is working, and then if her work is paralyzed rather, so definitely that is additional strain on her. That her at present her financial whatever whatever her financial requirement is there, that is more, her income is less. So on both the sides she's suffering. So naturally we have these social workers who are helping them at most of the medical colleges also, and most of the corporate hospitals also. You have these support groups who are also supporting them, not only emotionally but financially also. And definitely the insurance companies, as we have been discussing, they are taking care of all the treatment expenses.
Right. Niti, I wanted to ask you, as somebody who has successfully fought off this killer, and you're a living example that it can be done. Now, how do you motivate yourself to keep going on? Because you must have also had days when you're like, oh, I give up. It's just too much. But what motivated you? And any ideas you can give for women on how they can stay the course, because it's going to be worth it.
Honestly, while I was undergoing my treatment, I did not have days when I wanted to give up. That thought never came to me, because I wanted to live. Honestly, I just wanted to be fine and continue to live. But of course, there were days when I would feel extremely weak, when I would feel no energy in the body. There would be days when I would cry. So it's not that I've had a very smooth journey. I mean, I've had side effects and, some lows and highs. But one thing that I always took care was, that even on days when I was feeling very low, I would cry and I would come out of it. I never let my mind wander to questions like, if this happens, if that happens, what if I will not live? Honestly, in my, 6 months of treatment, I did not think, what if I will not live? Neither did I ponder over, why did this happen to me? That never ever came to my mind, I think these are two things which lead to emotional turmoil in a lot of patients, when they start to question why it happened to me. And a lot of people ask me that question, when they're being diagnosed. And my one thing is, that you can never really know why, there's no answer to it really, no matter how much you think about it, whether medically, karmically, this or that, whatever one believes in. And two, why is it, when it comes to cancer, that we have to think, why me? If somebody has a relationship issue or some financial issue, how many people question it in the same way? Oh my God, why is it happened to me? Somehow when it comes to cancer, all of those questions come to the mind. And two, like I said, that I've been a very carefree person, since my childhood. So when I had got diagnosed, everybody around me, like my family members, I remember, of course, that they were crying when I broke the news to them. And I was the one, who was actually hugging them and telling them that it's going to be okay. Don't worry. Because I had this faith that I'm going to be fine, And such one thing that I tell everybody is, who are being diagnosed with cancer, that there's no running away from it, No matter how much we wish, that you sleep and you get up in the morning and everything is reversed, that's not going to happen. So as soon as you accept the news of diagnosis, the sooner your healing can begin, The moment one accepts that, okay, this is what I've been diagnosed with, what now? That is when the action plan comes to your mind. That is when you can think about future and now what to do, what steps to take. And that is what encourages you. So
definitely.
I just focused on, one day at a time.
One day at a time, and the fact that in the future,
later, 6 months later, no. I just focused on being okay today, and we'll see when we move to the next day.
Right. Taking a day at a time really worked for you. That's a great idea. Dr. Kannan, Dr. Sharma has corrected me and said, do not call this disease a killer, because this is one which is highly curable And that is what we want. This is something that people don't feel hesitant to talk about and come with their problems early on. So Dr. Kannan, do you think if we speak more about breast cancer or all cancers, and we, along with making them aware of how to catch it early, we also tell them that it is not your fault that you got it. You didn't do something that you got it. There are things you can do to reduce your risk. Do you think then, this whole thing about why me, what am I going to do now? Oh, this is a death sentence. All this will go away. And, if the patient is in a more positive state of mind and accepting, the course of the treatment becomes a little more steadfast for them. And they are more, determined to go through it all.
Yeah, you're quite right. I think now I used to tell my patients, when you get diabetes or when you get a heart attack, you really feel so bad. They don't feel so bad at all. In fact, they're proud that they got a heart attack and they had a angioplasty and they are out of it. And why can't they think about cancer also in the same way? See, breast cancer is one, it's highly curable. More than 90% of the women, they live long or even 10 years and beyond if you detect them early. Even in advanced stage, we found that hormone positive patients live beyond 5 years. So it's not so bad. Breast cancer is one of the most curable cancers, and we have to keep talking to everybody. And the survivors have to spread the news that they have come out of it and they are living normally. So I think, and the other point, the stress, the stress, scientifically, there is a relationship where the sympathetic nervous system and the hypothalamic pituitary axis, they are the normal stress mechanisms for anybody. Immediately the adrenaline rushes out, and the protective mechanism in any person when there is an external insult to the body. But, in a patient who has cancer and they constantly think about this and they are stressed out so much, there's so much of stimulation to this axis, they become, the chronic stimulation makes the tumor also little resistance and the growth rate also. The healing also comes down. So we have to counsel them, make them, feel that they will be all right, the positive approach. So the stress should not be there. In fact, one of the reasons for increasing incidence of breast cancer among women is the chronic stress. They go through a lot of stress in the world, like in your family, outside, in the workplace, earning, and everyday activities. There's a lot of stress. Stress is also one of the causes for breast cancer. So I think a lot of teaching and talking about breast cancer and the curable nature of the disease goes a long way in the society.
Definitely. And this is our campaign. We are talking about this because we want women to feel that this is something they can overcome. It is a chronic problem that could happen to anyone, and it is not their fault that they got it. And they should be willing to talk about it and take necessary steps to detect it early. Now, as part of our meaningful action and awareness to eradicate breast cancer from India, we feel that there is a severe need for the national pledge in the form of a public campaign to create awareness among masses about breast cancer and taking appropriate necessary actions to come out of it. Through this national pledge, we invite the government, responsible authorities, private organizations, educational institutions, cancer survivors, influencers, and prominent personalities from various segments to come forward and show their solidarity and support this national pledge campaign to build accessible infrastructure, information centers, and awareness on prevention, the timely treatment to eradicate breast cancer from India. We wholeheartedly welcome Novartis for supporting this massive drive, and we are privileged to have the support of everybody on the panel here today. Thank you so much for talking about this, creating awareness, and I would request all of you to please go to our website, ihwcouncil.org, and do sign this pledge so that, more people come on board this campaign. We talk about this and we try to catch breast cancer early and have better prognosis for all the patients who undergo treatment. We will all pledge our support to continue the national pledge campaign to fight breast cancer until we achieve 0 cases in India. Let's all pledge to make Bharat breast cancer mukt. So I hope all of you will also sign this pledge, and we will then go forward with a concerted attempt and talk about this, talk about our friends, and get them more involved in this entire the gamut of breast cancer to find it early. Dr. Buyar, I think you wanted to talk about screenings, because we spoke about diagnosis and what would be the best way forward. Now, the consensus seems in our country that a clinical breast examination is the best way forward, and starting it early, because in our country a lot of young women are being diagnosed. So what would you want to say? How can we strengthen the screening system?
Yeah, taking this oath and taking this campaign ahead, I would just like to say that yes, definitely, as we are talking about breast cancer, early diagnosis definitely gives you completely curable disease, and that's a very reason role of screening and awareness very, very important. So risk screening, breast screening, and genetic screening, these are the three aspects we cover as breast committee. Across India, we are making awareness about breast cancer and risk screening. What risk you have, whether you are a woman, that itself is a big risk for you to have a breast cancer. You are advancing age, your early menarche, late menopause, and of course your family history, having a BRCA1, BRCA2 mutations, all these things would add to your risk. Your breast having some abnormalities which you are supposed to notify and get it screened either with self-breast examination or clinical breast examination. Also, there are certain risk factors which are modifiable. So that is in your hand. As we are all the time talking about breast cancer, they are not preventable. You can diagnose early, treat completely, but you cannot prevent breast cancer. But there are certain risk factors which are preventable, modifiable, like your alcohol consumption, your smoking, your age at marriage, having your first child after 30 years, maybe your breastfeeding practices. You are not breastfeeding the baby. These are all the risk factors which you can modify. So you have to work on all these risk factors. And then, of course, your breast screening, as I have already said, self-breast examination, clinical breast examination, if needed, necessary imaging and tissue diagnosis. So all these things have to be notified, and it has to be, made aware. The general public has to be made about the available investigations, and of course, the need for genetic screening for the patients who are having the family history of either breast cancer, early breast cancer, and certain type of malignancies in the family, like breast cancer in the male relatives, prostatic cancers, colonic cancers. So that's a very reason we are supposed to have all these types of screening procedures, so that we can diagnose the breast cancer at the earliest, so that it is completely curable. And the stigma behind the breast cancer, rather any cancer, that we are diagnosed with cancer, so we are going to die, and the sympathy which is associated, all these things can be prevented. Right. Thank you, Anisha, for giving me the opportunity.
I think Dr. Buyar, you meant that the pity that comes to cancer patients should be avoided. And if more people are aware about cancer, and the chance of people getting it without blame and without finger pointing, I guess it will become easy for many more, for all kinds of cancer patients. Now, we're coming towards the close of the show, and I'd like to take some concluding remarks. Let's begin with you, Dr. Sharma. Dr. Buyar has given us the whole gamut of screenings that should be undertaken. But like Neeti told us, that the women are so hesitant, even if they know that a screening is there, even if they know that they could be high risk, they may have inhibitions to go ahead and go in for these screenings. So what would you like to say as a last word, so that at least this kind of doubt should not come, to prevent women from taking action when it's needed?
I think this is a very good platform, and most of my colleagues, panelists, have already listed many issues. So I think from my side, that breast awareness, or knowing about the breast health, so rather than promoting it as breast cancer, we promote it as breast health. And most important, if the lady knows about her own breast, then probably she may pick up any abnormalities earlier. So I think the breast health remains topmost importance, and the education about the breast health may be imparted during the school health. Like my colleague has suggested that they are targeting the adolescent girls and the school girls so that they can be educated and imparted the knowledge of self-examination, screening test, early detection, importance of early detection. It can be imparted in the early school age, and these girls will motivate their mothers and they will motivate their in-laws also for that. And I think the last part about the education activity, patient support group, that remains topmost thing, and most developed countries, they have patient support group. We are also in practice now to make the patient support group where the volunteers who had undergone the trauma and the treatment, and those who are the warriors, we call them not cancer survivors, I call them cancer warriors. So they are the warriors and they educate the females, and their voice becomes much important than anybody else. Other than that, at logistic level, I feel the screening should be included in the insurance coverage. None of the insurance coverage, they allow us for the screening for most of the disease, maybe non-communicable disease, including cancer. So that also remains topmost thing. So most important message from my side, that do not get shy about your own breast, take care of yourself, do not neglect your own health, and get the all the screening tests as recommended by the doctors. Thank you.
Dr. Kannan, what would you like to say? Medically, when a breast cancer patient has come to you, so many things they have to deal with. You may get the best quality medical treatment possible. You may be able to finance it also because, there's a government scheme or there's a corporate helping you. But there may be other issues where you feel very lonely and you feel that there is no one to talk to and you don't get the help. You just said that stress is really bad. How important is, the mental and the spiritual health of a cancer patient as well? And who can address this?
Actually, the consultant, the doctor should talk to their patient first. That whatever problems the patient has, they can usually tell doctor, and then you have to discuss with them, and you find, you tell them that you can communicate with so and so. We have some of the social workers who can talk to them, counselors who can talk to them, and then also the family members. And I also usually tell some of the family members, their husbands, the spouses, and sometimes their sisters and the parents, to talk to them, to to make them better, feel better about this, recovery period, and help them to relieve the stress. And also we tell them to take a break from their routine activities, stay away break from their routine activities, stay away in a holiday, take a holiday, break for 2-3 days in between, or between the cycles, they stay in a different place and move with different people. And, there are lots of activities which you can make them, relieve the stress. The most important one is educating the family members to give them the stress relief. The most important one is the spouse. If the spouse is understanding, I found 100% the woman is able to undergo the treatment completely, and which is not available in all places. It's usually the parents or those siblings who come to their help, complete the treatment, and then they go back to their normal life. But sometimes you find the husbands are not even close to them. They reject them. So that should not happen. So the counseling, the patient and the family members together, and also putting a support group, as Dr. Lalit mentioned, that on the whole, you should take the picture in a total form, not just the cancer treatment, but the physician plays, or the consultant oncologist plays, the most important role of initiating all this.
Right. Dr. Kamla Rai, Dr. Sharma is saying that insurance companies should cover the screenings. Screening is a very small part of the total expense. Should you be diagnosed positive for cancer, insurance companies, normal health insurance doesn't cover cancer. You have to buy a special cancer care, cancer protection plan. Now, how can we, get insurance companies on board to perhaps, be a little more open to cover, cancer as part of regular health insurance, because now there is an awareness about, after COVID and the devastating impact it's had on family and finances. There is an awareness that, let's get health insurance, and health insurance sales have gone up. But, cancer is in our country projected to be a big problem in the years ahead. And, we need some kind of support, because yes, the government supports the BPL, but there's a huge middle class. And for them too, cancer expenses are very, very significant. What can insurance companies do? What can corporates also do to, if nothing else, at least support their own employees? Should they be, with finances, should they be diagnosed with cancer?
No, I think it is proven and it's established that the healthcare allocation, the impact of healthcare utilization is much lower if it's caught early, and the cost goes up if it's caught later. So I think it is very prudent, in fact, to sensitize insurance companies to see it's in the long-term interest of the insurance companies or maybe the government to fund screening, because earlier, and this is established data, that the later you detect, the cost of treatment of advanced breast cancer is much, much more than if you catch it early. So rather, the sensitization programs for these companies and for institutions that fund is very important. It calls for a multi-pronged approach as well, but I think there's enough data to show, and this goes back to how well-established countries are running best screening programs, and they're showing that the earlier you catch it, the better there is for. Earlier you detect, the better it is for the national exchequer, maybe even for the insurance companies. You don't want a patient to be consuming healthcare resources at a later stage. So I think it's a matter of sensitization, data sharing, and I think we live in a connected world right now, and we can bring together a lot of and the systemic reviews. There's a lot of data that proves what I'm trying to say. So I think it's only a matter of time that insurance companies will realize that it's in the interest of the companies to fund or to reimburse screening rather than wait for to reimburse an advanced breast cancer. So what I would propose if I were the decision maker is to really sensitize, with the payers and also with governments, to make sure that there are a lot of cost-effective analysis, the health outcomes research reports, there are a lot of bodies that put together data around this. So we require a multi-pronged approach. Sensitization is key, education, and of course data sharing to show that later you treat later, it's worse for you, then you fund screening much earlier. So I'll stop at that, but if required, I can demo insights.
Dr. Rai, I have one question. Now, I have worked in an organization which is very caring for women. HR departments will have tax day, tax assessment. They'll get somebody to help file your taxes. They'll give a bank a space to set up a stall, open a new bank, offer loan, whatever, give your services. You do give your employees an executive check, but it doesn't cover mammography, or it doesn't cover even a CBE. So, I'm just trying to understand if drug companies can then, get something like this, a breast health, camp set up in companies, because, a lot of women will be covered there. Could drug companies or look at something like this, a camp for breast health for women, and do it, say, once a year, where, at least these women will get covered? Absolutely.
I think over the years, drug companies, pharma companies, they have been a big stakeholder in this journey. We're all in this together. I think in the video which you showed earlier, I from last year's video, I recollect I liked one quote that said, "It takes a village to raise a child." And similarly, I think for this as well, pharma companies or corporates or we are a big stakeholder. So you're right. I mean, making sure that we support patient support groups, run awareness campaigns, because there's a lot of wisdom within companies which invest a lot in oncology and especially in breast cancer research. There's a lot of customer in perspectives, a lot of insights. And as I said even earlier, we have a new discipline called psycho-oncologists that's emerging. New discipline of oncophysiotherapists that's emerging. I think it's a holistic approach, and we are a very big stakeholder along with the treating physician who's at the center of it, along with the patient. And in the ecosystem, I think we have a role to play in raising awareness. We have a role, and it's a society at large. How do you sensitize, the community, and what is your approach to making sure? And I think so far, I think pharma companies have been playing their part, and maybe as required, we could step up on some of these awareness campaigns, and especially considering the geopolitical construct. India is a $1.3 billion population with 0.65 billion female population, and we have a significant stake in the global healthcare space. So I think it's imperative that we look at this holistically. We make sure that patient voices are heard, healthcare voices are heard, and we design programs not just around treatment, but also around screening and awareness and sensitization, even at workplace. So I think there is opportunity. I wouldn't look at it as a burden. In fact, I think somebody said we reframe this instead of cancer survivors, we call it cancer warriors. And I think if that is a new definition of an interesting construct, I think we have to reframe our approach and sensitize the community internally as well as key decision makers in this journey. That patient breast cancer warriors, to make it easier on them.
Right. Niti, you've been diagnosed many years ago, and you've been working as a votary to raise awareness about cancer. Are you doing this because cancer changed you, made you think of yourself differently? And what changes have you seen over the last 10 years since when you were diagnosed, you got treated, and now? Is there any change?
See, even before cancer happened to me, I was always moved by, difficulties that people were facing. So like when I was working as a full-time faculty, I started with the social forum at my institute, So we would cater to children also, old age also, and everything. So I think cancer gave me a direction. It's not that I suddenly became compassionate, towards what people were going through. But yes, of course, I think cancer gave me a direction. I left my job after that, and I've only been devoting my full time into this because, there were two triggers for me. My son was 3 years old at the time when my diagnosis had happened. And during my treatment, I met a lot of other women, who were being diagnosed around my age group. They had very young children, but their diagnosis had happened at very later stages, So talking to them, meeting them, it would give me a lot of pain to see, or, I would feel, that had they been diagnosed at early stages, they would not have been as fearful, or, they would have had a chance to be with their family for so much longer time, and lead a more quality life. Then I once went to a government hospital for a second opinion, and I saw patients lying on the floor there, waiting for their chances to come. So this was the second trigger again, something that gave me a lot of pain because it's not an easy treatment, and then I know the hospital is doing everything that it can, but the burden of cancer is so much. So that is the time when I thought, that instead of feeling bad about people or, what is happening in the society, if there's something that is moving me, I have to do something about it. So that is how I started, and, have been working towards both breast cancer awareness and patient support as well, financial, emotional, and rehabilitation. And of course, it's given me a bigger purpose in life. I feel so happy and satisfied by the work that I do. I have never felt, that I would want to go back to a job again. No, never. I mean, this is what I want to keep doing. And also, of course, you understand the meaning of life better, and the importance of life also. It's become so much easier for me to manage stress now. Not that I used to take a lot of stress before, but it's become even better now. And it's not just for me, it's for people around me as well. And honestly, like, if you ask me, do you want to be in a situation where cancer had not happened and you would have been living the same life? I don't want that. I am very thankful to every experience that I've had in my life. I'm very thankful for where I am today, for what I'm doing. And I just want to move ahead, helping more and more people. There's just one point that I wanted to add, if there are 2 minutes, since we've been talking a lot about financial, in terms of difficulties that people face, because our main focus has been for people from lower income group. But in my experience of working in this area, while the government has a lot of, schemes for people from lower income group, I feel there's a bigger problem when we're talking about people from lower middle class, because most of the times they don't fall under any of those schemes. Neither do they have those kind of hefty insurance for them, that they can afford it. I think that is one area maybe that should be taken up as a point of discussion at some point in time, I think they are the, one group of people or society that face the burden of finances even more than people from lower income groups.
Yeah, and we will need to get more policymakers to talk about it. And actually, I think there is a thought process to perhaps expand the Ayushman Bharat program to cover a larger part of our population, and perhaps cover these chronic conditions as well. And let's hope that happens. Our main aim is to create awareness about this problem. There are many aspects, and the financial strain is an important aspect, which is why we feel that everyone should try to detect this early, because when your treatment starts early, the treatment is shorter, the financial consequences shorter, the quality of life is better. And this is, a campaign from our side that we would like everyone to be aware of breast health and to catch this problem early on. I would request Dr. Buyar to leave us with her last word on, the stigma attached or the way women perceive breast cancer. What would you like to say, ma'am, so that, women are not afraid and they come forward early enough to, nip this problem in the bud?
Yes, I think in spite of this newer modalities of management, right from the radical surgery to a conservative surgery for early breast cancer, where there's no question of fear of life. In fact, you can even conserve your breast as well, which was supposed to be, very demoralizing for women. So with this very positive situation and the scenario of cancer management, especially for breast cancer, I think women should not be worried about their diagnosis of cancer. In fact, they should think it positively. Yes, they're diagnosed at an earlier stage. It's very good for them that they can go ahead with a early breast cancer surgery, that is a conservative surgery, and it's not going to have much of recurrence, and their life will be, as good as normal. So I don't think there should be any stigma as far as the breast cancer is concerned. We have to take it very, very positively. And as I have earlier also stated, that if the malignancy is diagnosed through screening, it will be much earlier as compared to what it has presented as a symptom or a sign on examination. So I think definitely we have to take it very, very positively, and screening is the only way forward. Mass awareness and mass screening is the only way forward. And definitely as far as breast cancer is concerned, early diagnosis can save life. I think that's all from my side. Thank you so much. And that's the very reason, as a breast committee person, I have been talking to all my popsians, the gynecologists, whatever their reason, make it a habit to examine their breast. And you find out any abnormality, if it is present, then you offer them a battery of investigations. And if they don't have any abnormality, at least you make them breast aware. You teach them self-breast examination, so that, we are the ones who are privileged, and we should use this window of opportunity because early diagnosis can save lives. Thank you.
Yes, thank you all for joining us and reiterating the importance of early screening and the fact that there shouldn't be a stigma or a fear or worry attached to breast cancer. Like Neeti has told us, like all our panelists have told us, that this is a disease that one should accept. It is highly curable should you detect it early, and that should be your mission. And it is our mission to create awareness about this. Thank you all for joining us. We look forward to meeting again on another episode to talk more about the different aspects of breast cancer. Join us again. Till then, bye-bye.